go ping. It's the NHS app. Currently, more than 500,000 alerts last week alone, recommending people self-isolate after coming into contact with someone who tested positive for the virus. Now, this is already having a serious impact on care homes. They're already short of carers, badly paid. It's a badly paid job, hard work, and many of them now cannot take the chance of not isolating because they work with very vulnerable people. It's having a bad impact on the NHS, on our hospitals, and there's the hospitality industry finally getting back on its feet. Ping, 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 it goes all the time, and hundreds, thousands of people being sent home, many bars and restaurants being shut to compound what's already been a dreadful nightmare 15 months for people in that particular industry. So I'm asking you, if you have been pinged, you ignored it, have you even bothered to check your NHS app to see if it's telling you to isolate, or are you one of the growing numbers of people who've just simply got fed up with it and have deleted it? The number to call is 0345 6060 973. You text 84850. You tweet at LBC. I'm going to talk now to Dr. Bharat Pankhania, who's a senior clinical lecturer in public health at the University of Exeter Medical School. Dr. Pankhania, good evening to you.
Hello, good evening.
This is a problem for the government because on the one hand, they want people to take this very seriously. And on the other hand, this is now beginning to have a devastating impact on care homes, hospitals, and all sorts of commercial businesses. What's your advice to people?
There's two bits to this. One is if you have been pinged when your phone was in close proximity to another person's because you left it in a locker room or something like that, then we know that that is not a relevant ping. On the other hand, a lot of people are being alerted because the case numbers are shooting up, and it is a honest ping that they have been in close proximity to somebody who has now become a case. So it is really a bit of both, but I fully accept that in many occasions the application is not perfect, and therefore we've got to do some assessment of have I truly been in close contact with the case.
Because how do we know the difference, Doctor? How do we know whether it was that you were genuinely in contact with or whether it was, as you say, you may have left your phone in a locker and you've been pinged? We've heard of people being pinged because somebody next door in a house with brick walls separating them have been pinged and told to stay at home.
So I've been dealing with this for almost nearly a year now, where we know, for example, with school teachers, they were in separate classrooms, and under that circumstance, I have taken the executive decision to say, I don't think you were a close contact of the case. Your telephone thinks you were, but I have done my assessment. Having said that, this is special in that I can do that, etc.
Yeah.
Most people cannot do it, and therefore it is a bit of a mess. All you can say is, think about it. Is it pinging you because you were on a crowded bus over a long journey, or is it pinging you because your phone was in a place and other phones were also in that same place? Very difficult.
The other thing is, I think some people, Dr. Pankhania, do not know whether they've been pinged or not. So, for instance, I've heard anecdotally of many people, I better check my NHS app, and it says you're now released from isolation, and they didn't know they'd been meant to be in isolation. So does the ping need to have a more distinctive way of making its presence felt?
Of course it does, because the instrument is only as good as how well it works. And all of these little bits of evidence is indicating that whilst it was good technology to deploy, it is very rough at the edges. People don't know if they've been alerted. People don't know if they have been truly alerted, and some people, as you said in your report, have probably disabled the application as well. So it is very rough at the edges. I would look at it as a tool to help me, but I wouldn't use it as an absolute tool to guide me on what to do.
But as someone involved in the battle against COVID, as a key role in public health, it must be very worrying for you that there are many, many people now who tell us that they are deleting the app because they're fed up with it. And they've been double jabbed, and a lot of people who've been double jabbed think that's the holy grail. I don't need to isolate.
That is worrying to me. But the other bit that is even more worrying to me is July the 19th,
Mm.
where the narrative with the people that I deal with, and I deal with thousands of people, is Prime Minister Johnson has said you do not need to take precautions after July the 19th. And that really worries me, because that's their perception. The narrative, the message should have been, we're releasing restrictions. We want you to continue with what you can, infection control measures. Unfortunately, that message hasn't gone out that way. And the messages I am hearing are, I'm not doing any more infection control post 19th of July.
Would you have preferred it if, when he announced those restrictions are being lifted, he said if he'd said, however, the government wants you to continue to wear masks in enclosed spaces such as a tube or a train or a coach or a bus?
I wouldn't want him to just say the government wants you. I would like him to say, I mandate it, that it is compulsory, that you will wear masks in these places, because it is a small inconvenience to achieve a great good, especially against a background of a highly infectious Delta variant. So this Delta variant is about 3 to 4 times more infectious than the original Wuhan wild strain. And then people are dropping their guards with other things. So it's a small measure which would have gone a long way, especially schools, buses, tubes, trains, etc.
Currently, we know hospitalizations are increasing, Dr. Pankhania, but I understand that often people are being detained in hospital for less time than at the height of the pandemic, and still currently the death rate is not showing any huge increase. Is that your understanding?
Yes, that is my understanding, and I feel this is the dividends of having a immunized population, and the vaccines are weakening. They're not severing, but they're definitely weakening the link between being admitted to hospital, being severely ill, put on the ventilator. So that's really good. About 52% of the population has been fully immunized, the entire population, children upwards. So we've still got some work to do with regards to the younger age, and what are we going to do and address this. One biggest elephant in the room that is not being addressed properly at all is schools. What are you going to do with regards to immunizing school children? Are you just expecting them to get infected and hope for the best? Or are you going to immunize like the United States, Canada, Israel, Netherlands, France, Hungary are already doing?
And what age, Dr. Pankhania, would you say those children should be vaccinated from?
Well, the license is for 12 years and above, and
Right.
And if I had a license which said from younger age too, I would also go for that. I have worked in vaccines and immunization for over 30 years, and I know how children in school settings pass on infections to others, and then the older people get it, and then the elder people get it, and so on. So it is an important preventative measure to take to immunize at that age. And we do so with seasonal influenza vaccines. We do so with the preventative measures from HPV vaccine. So it's not a new thing to be doing to prevent and protect our population.
Just finally, on a scale of 1 to 10, Dr. Pankhania, I know you're not a betting man. How concerned are you about July the 19th, Freedom Day?
I am very concerned, so I would say about 8. And my reasons for 8 and not 10 are, we've got about 52% of the population fully immunized, so that gives me some comfort. We're not getting so many deaths, that gives me comfort, but I remain concerned about the younger people. So I went for between 7 and 8.
Yeah. And people listening, your advice: wear a mask when you're out and about.
Absolutely. Not only wear a mask, but please wear a good quality mask. The Delta variant is more infectious. So up your mask to an FFP2. It fits better and it will protect you. I really would say go and buy them and wear them.
All right, that's Dr. Bharat Pankhania, Senior Clinical Lecturer in Public Health at the University of Exeter.
Thank you very much for your time. Really appreciate it.
Over 520,000 a week now are being told to self-isolate. I'm asking you.